guys, and welcome back to Cap Bailey ASMR. We're going to get started on our exam very shortly, but first I want to say, if you're new here, feel free to hit that subscribe button down below. It helps the channel grow, so that's always good. If you enjoy the video, hit the like button down there as well, okay? If you don't like the video, I'm sorry. But that's all I got. I hope you guys enjoy this video. I hope you find it relaxing. And without further ado, let's just dive right into it. What brings you into my office here today? Oh, you're just getting your eyes checked. Okay. You think you might need some prescription classes as well? Okay. Alright, well, we can take care of all that here. My name is Bailey, and I will be your optometrist today. Before we get started, I need to log some basic information from you just to make sure that you're the right person here, okay? So if you would not mind, can you please confirm your last name for me? Okay, perfect. Your date of birth? You look much younger. And then lastly, the last four of your social. Okay. Perfect. Well, let's go ahead and just dive right in, okay? Again, my name is Bailey, and I've been doing this for quite some time, so rest assured you're in good hands, okay? This is going to be a very, very easy, hands-on, hands-off kind of exam. I'm going to be coming in close, checking your eye health, general eye health. I'll be using some magnification to assess what sort of prescription you might need. And then I'll go in and just perform a series of tests after we've gotten you fitted for some prospective classes, just to see how your eyes are performing, okay? So without further ado, let me go ahead and go back there and get my rubber glove so I don't transmit any bacteria over to you while I'm touching on you. And then we'll get started. Sound good? Perfect. Okay. Hang tight, my friend. So how long have you been living in the city for? A few months, okay. Well, how are you liking it? So far, so good. That's what I like to hear. That's good. There's actually very good restaurants in town. And who was your previous optometrist, might I ask, where you're from? Okay. What do you know their email address? I need to probably get your paperwork transferred over here so that I kind of know what I'm getting into. Okay, sure. At optometry, okay. Beautiful, wonderful, wonderful, wonderful. Okay, well let's go ahead and get started here, okay? What I'm going to do is just have you read a basic Snellen chart for me so I can gauge the overall health and condition of your eyes, okay? You're currently not wearing glasses, obviously. So are you able to read this chart over my shoulder here? A little bit blurry. Okay, what's the lowest line you can read? LP, kind of rough to read that. Okay, all right. I've got a handheld Snellen here. It's going to be a little easier for you to read, and then I'll be able to get a better, understanding of where your eyes are. Okay, so can you see this a little better? Good. Okay, perfect. Well, do me a really quick favor, okay? Read this line here for me. FPH. Okay, can you go ahead and come down to this line here? You can read that pretty well too. J H D F C. Okay. How about this very bottom line? H P F really quickly, I'm going to use our card here, okay, to cover one of your eyes and have you read out of your left eye and then your right eye, respectively. Does that sound good? Good, okay. All right, covering up your right eye here. Can you read this line that my finger is on? Fourth line down. Excuse me, fifth. BS. Good. Okay. Let's go ahead and cover your left eye now. And can you read the same line but backwards? Okay. Very good. Yeah, good job. Good work. Alright, so obviously distance vision is a struggle. So we'll get that addressed. Your up close vision's actually quite good. Better than normal, but that can happen sometimes with stigmatisms and things of that nature. We can get, have trouble seeing from a long distance. But we'll take a look at it. And what I'm also going to want to do during this test is cut off our immediate lighting here, just to make the room darker, and I can get some lights shining into your eyes directly to see how your pupils are responding and check the overall health of your optic nerves. Does that sound good too? Okay, I might have to dilate you for that. Just be warned, it stings a little, but it's not too bad, and I'll make sure you're okay through the whole process. Good, okay, wonderful. Sweet, well, let's go ahead and get into that portion, why don't we? I have a set of lenses here, okay? These are just going to be different magnifications that may or may not help you see this chart over my shoulder here, okay? I have a handful of them, actually. And we'll just start out here with our 300 millimeter double convex lens, okay? Wonderful, and I'm just going to place this in front of your eyes, okay? And you let me know if you can see this chart any better, okay? Ready? All right. So better or worse? Better or worse? Okay, let me turn it over now. How about now? Better or worse? Better or worse? Okay, so too much. Gotcha. All right. And like I said, this is just going to help me establish a baseline for how your eyes are doing, okay? This is going to be a little easier to see out of. This is a 300 millimeter double concave lens, okay? Yeah. Okay. Now, same thing. Let me know if this is better or worse, okay? That's actually helping to see those letters behind me a little bit. It's sharpening them a little bit. Okay, how about I turn it over? Better or worse? Better, okay, better. So this lens is a little closer to what you might need. And we'll get it dialed in, like I said. Better, worse. Better or worse? Good. You're doing a good job. Good. Okay. Wonderful. That is good news, my friend. So here we have our 200 millimeter. Okay, this is probably going to be even better. Okay, and I believe this was our double concave. Yeah. Okay, so let me know again. That one's actually worse. Okay, so that's two. Not enough. Not enough magnification there. Better, worse. Better, or worse. Okay. Better, or worse. Okay, gotcha. So, more like a 300 millimeter, probably somewhere between 300 and 350 millimeter. Just slide this back in. Good. Okay, let me put our intermediate lenses back in the box. And then we'll get started with the dilation process, okay? Checking your overall eye health, and then we'll move on to some possible glasses options, okay? After we cut the lights and do our exam, okay? But, so far you're doing very good, okay? I see nothing to be concerned about. Very happy with how you're responding. And, again, you're just doing a good job, so keep up the good work. Good. Place these over here. Don't mind me, I'm gonna get a quick swig of coffee while we prepare to dilate your pupils, okay? It's good stuff. Okay. Now, what I have here is a dilation solution. It's going to help to open up your eyes a little bit, okay? That's going to allow me to see in and, like I said, check the overall general health of your eyes, okay? So I need to apply a few drops to your eyes to get that process started. So let's go ahead and do that. And during this, what I need you to do is just keep your eyes open, keep your eyes up. I'm going to probably grab onto your eyelid, pull your eyelid up so I can apply the drops accurately. Okay? Good. All right. Okay. You can just mix up the solution a little bit. Okay. So I'm going to grab your left eyelid here, pull your eyelid up, 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 up. Good. And then drop, 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 drop. Fantastic. Don't rub on your eyes, okay? Let that take effect. I'm going to get a little more here for your other eye. Pulling your right eyelid up now. Good. Pulling it up, 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 up. And then just drop, 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 drop. Good. Good stuff. And how's that feeling? Not too bad? Okay. Good to hear. We're just going to hang out for a second, okay? And let that take effect. Like I said, don't rub on your eyes. How's everything feeling? Okay, good to hear. Good to hear. I mean, obviously it's not too comfortable, but It's part of the process, so it's good to hear that it's actually working. Okay. I'm going to go ahead and get your eyes cleaned up for you. Just don't mind me. Just wiping that away. Wiping away the excess solution here. You're doing a good job, my friend. You're doing a good job. Good. And dispose of this cotton ball here. And we're going to get our other one here. Place our solution over there. And clear up your other eye here. And this should eliminate a lot of that stinging sensation you're feeling. It should eliminate any of that stinging. Good. Good. Good job. You're doing a wonderful job. Okay. And we'll just place these in our trash bin over here. Okay. And I'm just going to brush on your eyes here to clean up the rest of that solution. Good. Good. Good work. Your eyelids here. Just close your eyes for me real quick. Good. Just gonna help eliminate any of that stinging, okay? Going over your left eye, your right eye. Good. Good job. You're doing a great job. Fantastic work. Done. Okay. How's everything feeling? Good to hear. Okay, fantastic. All right. Now that your eyes are dilated, okay, I'm going to go ahead and cut our lights off. I know the light's causing sensitivity to you. But we're going to have to get our torchlight out, okay? I'm going to check the overall health of your eyes to see if you have any sort of issues with your optic nerve, if there's any busted blood vessels or veins coming through your sclera, up underneath your lid, above your lid, and just the overall general health of your eyes. So let's go ahead and cut our lights out. This is a very painless portion, and I want to see how your eyes react to this light stimulation as well. So we're going to cut this light off, and we're going to cut this light off. Good. Now just look at my nose, okay? I'm going to grab your lid. Good. 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 And pulling down your left eyelid here. You're doing a great job. Good. Just checking into your optic nerve now, checking the overall general health of your eye. Doesn't look like there's any issues into the optic nerve. The whiteness in the sclera is looking very healthy. No damage to the blood vessels or the veins pulling down your lid here. I don't see any issues. Looking nice and pink, good and healthy. Pulling up your lid. Good. You're doing a good job. Just keep it there. Good. And no issues with the top of the eyelid and your tear ducts. Your pupils are reacting wonderfully. Dilated at that, but nonetheless, good. Okay, my friend. That left eye is looking very healthy. Very, very healthy. Now let's go ahead and take a look at your right eye now. Okay, so same thing. Focus on my nose. Good. I'm just going to pull up your lid. Up. Good. And checking for any redness imperfections, anything that shouldn't be there. All is looking very good, my friend. Looking at your pupils and your optic nerve in the back of your eye. And good. Not seeing any issues there. Everything's very healthy. The eyes are good and clean. Let's pull down the lid now. Pulling it down. Good. And good and pink. I don't see any issues at all. Checking your tear duct here. Good. Good. And the pupils looking nice. The retina. Beautiful. You have a very nice eye color, by the way. Okay, now what I want to do is have you follow my line, okay? Very basic test just to see if both your eyes are working as they should be. Then I'm going to get our card out again and cover each eye respectively and test pupil area response in correlation with the other eye, okay? So right now, just follow my light for me. Keep your head still. Good. 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 And down. Good. Coming in from the right. Going left. Good. Coming from the left. Going right. Good. Alright. Follow my light. Up, 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 closer. Allow yourself to go cross-eyed if you need to. Good. Backing it up. Backing it up. Good. And good. Okay. Let me get a little bit of magnification here, okay? I'm just going to check into the back of your eyes now. Just focus on my nose if you can, okay? Good. Focus on my nose if you can. Great job. And just continue to focus on my nose. Focus on my nose if you can. Good. Right here. I know. Good job. Good. 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 Good job. Okay, my friend. Your eyes are performing beautifully, okay? So that is good news. Very good news. Alright, now I'm going to cover each eye respectively. Test your pupillary response here, so focus on my nose again, or just on the chart behind my shoulder if you need to, okay? Right back there. I'm going to cover your left eye first, okay? Good. 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 You're doing a great job, my friend. Good. Good. And good. Okay. Now let's go ahead and check your other eye. Checking your other eye now. Good. 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 Yeah, just focus on my ear if you need to, okay? Right here. Good. Just focus on my ear. You're doing a fantastic job. And good. Okay, my friend. I really don't see any issues at all, okay? But it seems like we have your vision dialed in, okay? We should be able to understand the magnification you need, so these next classes should, help a little bit. But you had mentioned to me that you did want tinted frames, okay? I've got 3 pair I'd like to show you, okay? And then a more of a transitional pair as well, so let's go ahead and cut the lights back on and we'll take a look at our glasses. Sound good? Okay, good. Turn this one on. And turn this one on. And overall rating, was that pretty pleasurable? Not too bad? Okay. How are your eyes feeling? Still a little stingy? Yeah, that should wear off here in a minute. And we'll have you hang out until you're ready to go home and drive. I don't want you driving with dilated pupils, okay? Very sensitive to light, but I'll send you home with some black glasses to allow you to drive if need be. So let's go ahead and take a look at our glasses now, why don't we? The first pair I'd like to show you is our transitional pair here. This is based on a 70s style of glasses, very popular in the 70s, but very also fashionable nowadays, okay? It's got a steel arm here, okay? As well as a nice traditional sort of Ray-Ban style frame, okay? All steel, very well made. And it's a pretty nice look, so we can put these on you, okay? And you let me know how things look through these, okay? How you feeling about those? Things are pretty sharp, a little more tinted. Yeah. I like these a lot too. I actually own a pair. So that's that pair. Looks like our nose pad fell off these, but if you were to get a pair, we'd obviously give you a brand new one. These are just the trials, okay? So we'll place these over there, keep those in mind. And then next, we've got a traditional style of Blues Brothers sort of Ray-Bans here, okay? These are going to be a polycarbonate sort of material, plastic, but a very dark tint, okay? And these are also going to be able to be put into your specific magnification to help you see out a prescription, okay? But these are very dark, yeah. Very good for hot summer sunny days, but definitely wouldn't recommend driving with them at night. Yeah. They're very dark. Okay. So, keep those in mind as well. These next two pairs are my favorite, but we'll save the best for last, okay? Here we have another Ray-Ban. These are a classic 60s kind of linen style gold frame, a little more oval shaped though with a flat faced lens, okay? These have a gold arm and are very, very nice, okay? Very stylish, okay? So I'll let you put these on, see how you like them. And they're also pretty dark. There you go. And what do we think about these? Also, you look very good with them on. Okay, perfect. We'll add these to your cart, okay? And place them back in the case. Snap that closed. And then, like I said, my favorite pair, okay? These are very, very nice. They're actually by a company called Persol. And these are very nice style. The case has a magnetic clasp. Very craftsmanship indeed. And they are a hard plastic turtle, kind of a see-through material. Very popular right now, with a nice brown tint to the lens. Kind of makes everything look like you're walking through the 60s, like very vintage visual outlook on the world when you're wearing these very warm colors, okay? We'll go ahead and pop these on you real quick. Yeah. Those look really good on you. Those are sweet. Very awesome. Very sweet. Sick. Okay. Yeah. 100%. I'll add these to your card as well. So we got your prescription figured out today. That's good. We got you some new glasses, so you'll be feeling sporty. And you'll be looking nice. And we also got your general eye health figured out. And my friend, I gotta tell you, tip-top shape. I see nothing to be concerned about. I'll go ahead and log your information, run your insurance, and we'll get you out of here, okay? Sure thing. All right, well, you just hang out and let me enter this information real quick. Good. Okay. And then we'll just confirm your information on your insurance. We'll get you out of here. Okay. All right, my friend. Well, as always, it's a pleasure seeing you. If there's anything you ever need in the future, please don't hesitate to come back, okay? I love seeing you. I love treating you, and I love that you're my patient. You did a fantastic job today, by the way. I know you were a little stressed about this, all these tests and whatnot, but I gotta say, you passed with flying colors, and next time you come in, maybe you'll be alleviated a little bit to know that you're capable of performing tip-top, okay? Sure thing, my friend. Well, have a great day, all right? And I will see you next time. Okay. All right, bye now.